that calling me after all these years, pioneering in this preventive medicine is really a satisfaction personally and for the company I represent. It's a long story. It's how is that we can intervene in the habits of people so that their health is not an issue for them and is not an issue for the society, and finally makes them all happier. So when I talk about this story, is about the root of this. So one achievement, milestone that I remember was catching in 2012, something that was unseen before. So with my own company called Delta Medica, we created something that was called medical life coaching. Everything was, and everything that we discussed today in this, let's say, perimeter of healthcare is in that name. There's medical, there's life, and there's coaching. Now, what is that we created? We created a ring system, we created digital, we created an app. We worked with big tech companies as Garmin, creating the first ecosystem in which we could keep track of life habits together with medical records. And that was 2012, when there was no such thing as an Apple Watch or the app Health made by Apple or all the others. So 12 years later, we have changed that. And let's say, what is that change? First of all, the name of the company, which is Cerba, today is a multinational company that has the core of Delta inside, and in Italy represents 400 sites, 4,000 people, of which 2,000 doctors and 2,000 employees, and has developed this product into what we call longevity. Now, is that my favorite name? No. Why? Because longevity makes you think of a longer life, which is not what we're talking about today. Eventually it is, but just eventually. Is about health span, is about reaching a different quality of life, a different quality of health for individuals. But you know, when in Rome, do as the Romans. So everybody today talks about longevity, so that was the most appropriate name to understand a path, a service, and a product that we have placed in 2024. Now, what is that the evolution created? One of I had the fortune. It was really a great day and occasion in which I had a big exchange with Satya Nadella that talked about AI, and he said a phrase that stuck into my mind was, the next metric in the world economy will be dollar per token per watt. So basically the secret is, what is that we do with the AI to reach what at what cost? So one thing we added into that was, first of all, the choice of the right biomarkers, which have increased tremendously, and the service, the system that we create, which is AI-based. So it gives a lot of help in what we do. So since Satya said the secret is that, I'm not going to tell you what we do with AI, since it's that secret, but it's a system that we have worked on. We educated in giving us the right app that we needed to give the best results possible to be understood for our patients. Now, what is that we have done? Have we invented the service? Probably yes. Did we invent anything scientifically? Well, what we did is that we studied a lot. That's what we did. We studied a lot what is the outcome of tens of studies provided by the top-notch universities in the world. We studied a lot the contribution that some individuals gave to this community, space industry. So if you put together all the relevant studies that are put by and done and put by all these universities, and you put together the lessons that reach from these individuals that are seen today as gurus, you can come up with something that really helps people. And you combine things and you work on things and you select the biomarkers and you figure out what can really change the service that you give to people. Because what is important is not just to come up with the right idea on how things should be done, but it's also to put things in practice and make sure that people will start using it and adapt their life depending on what service you can give them, and understanding and trying to transition into a thought where the community, the society, the state, the insurance, call it as you want, but somebody else will take care of their health, and transitioning into I have to take care of myself. I am responsible for my health. Why? Simply because I'm responsible for my happiness. So the longevity program comes, we talk about precision medicine, so first thing is it's different between women and men, and it's very individual. It starts with a panel of testing. First thing was, how do you choose the right biomarkers? We are in front of many possibilities. We are a company, we are the number one biology lab platform in Europe. So, of course, we have capabilities to perform any task you can imagine, genetics, for instance, and others. But what is it you put in the program? Well, first, put in the program things that you can change by changing your life habits, the first thing. Second part is pricing of the service you give. It's very important to understand that since, and I'm very keen to listen to what Alessandro will say later, but since we have to take care of our health, because for many reasons, this kind of medicine cannot be held by many other actors rather than yourself. So it's about positioning at the right price. So we made a big effort to be aggressive. But when I say aggressive, is we really want to democratize this way of care. So we came up with positioning at 10 times what would be normally considered the price if I go and look at, for instance, an American or a UK market. So we priced the service starting at 300 euros, giving all those. I'm sorry that it's a little too little to see all of them. But if anybody is interested, I have many things where you can have.
I was about to ask if that's confidentiality. So you want to avoid that?
This gives you information about the program.
That's free of charge.
Yes, exactly. But it's free of charge. So you start with that biomarkers. You get these results, and then you can decide how you want to stay close with your physician, how you want to stay close with your coach, because it's coaching they actually need that you have. You need to stay together with somebody that can tell you how to behave, that can give you the right information, that can give you basically what to eat, integration, exercise, rest, all of these together are the combination of your health, together with keeping track of biomarkers, which objectively are capable to track your risk factors, which is the other point. We need to minimize risk factors in individuals' health. So, what is the evolution since we went on the market? Once again, you always imagine that screens are bigger, but I don't know why. But, so what is that this slide shows you? It shows you how we made the evolution of this product by informing 5 million people, which are the people that come on a yearly basis in our centers meeting. We have all the professionals that put together, created this service, this product, and work, and are always available for our patients because we have created an area with digital services and telemedicine where you can interact with them. We have more than 1,000 people trained in our centers to give information and to present the product and to give explanation and to welcome patients that really want to change the way they keep track of their health. And the good portion is that since we put that service on, we have monthly 46% CAC growth in this service. So that is giving us an idea that we are on the right track. It's working, people are interested, people are using it, people find it very useful, and then they bring their family, they bring their friends, and it's working. Then the other point is that you can see how differently it goes so far, because it's been a few months in the country, so you see the areas where we have the highest impact and the areas where we have the lowest, but overall, we're active everywhere in Italy. And now at this stage, the other and last point is what is that we see in the future? And in the future, there is one thing that we see, or personally that I see a concept that we need to absolutely consider developing new services and new industries and potentially new startups and services, which is there is one device you cannot change when it gets outdated. We are in a world of devices, of data, of using AI, of using data the best way possible. And in this world of devices, there is one device that needs to stay in the center, is the only one you cannot go and change with something else, which is yourself. So put that device in the center of the ecosystem and get all the information constantly, work with it, interact with it, and make sure that device stays in the best conditions, because that device is the one that gives you happiness. Alessandra, who's going to pay for that?
Exactly.